where the line of gravity in relation to the joints. Okay, so when you look at the picture, dealing with the lower extremity, so it's anterior to the knee, anterior to the ankle, posterior to the hip joint, right? The pelvis, of course, has to be neutral in this case. Standing, it's also posterior to the lumbar, right? And posterior to the cervical, but anterior to the thoracic spine, right? So, especially for the lower extremity, the trunk is kind of, we don't have much of control on that unless the patient is leaning forward. So we instruct them to stand straight, shoulders back, hips forward. Whenever we have hips forward, means that the line of gravity is posterior to the hip joint, the axis of the joint, okay? And the patient would not lean forward at all. Even if your patient does not have any trunk control, if you have them, the line of gravity posterior to the hip joint, okay, that would be it. In patients with spinal cord injury, okay, those people, they have a completely paralyzed trunk muscle. We just instruct them to stand and lean backward. Okay, so the line of gravity is providing the stability that we need at the hip joint. All right, weight bearing should be evenly distributed on both sides. This is kind of a Armstrong thing. Okay? When we have the weight bearing evenly distributed on both sides, it's going to be stages 5 and 6. Before that, it's going to be kind of really hard to tell the patient, okay, we are emphasizing it from the beginning, but the patient is not getting it till we reach to stages 4 and 5. Okay, so if you are having this patient, like the guy with clonus, this guy is stuck at stage 3, correct? So whenever you have him trying to be on the affected side, okay, the therapist is trying to have him on the affected side. If I am his therapist, I'm gonna say, I want even. No much weight on this side, no much weight on this side. This is our nature, is to have 50-50. We have 2 legs, so the weight should be 50-50, right? Unless you are teaching your patient the weight, the walking, this is a different situation because you would have the whole body weight on one side, then you switch, okay? But for standing training, okay, I would emphasize the even weight distribution. We need some muscles to be active in standing. Glutes, hamstring muscles to maintain the pelvis position. Okay, we need the paraspinal muscles, we need the abdominal muscles, we need the quads. All these muscles are required to maintain the knee extension. But during the standing itself, they are not that active. Any like 1 or 2 degrees of knee flexion, that's when the quads start to fire up, okay, and to maintain that stand. In standing also, we have some sort of terms, okay, we need to memorize to help the patient and to help yourself in managing your patient. The first one is the limits of stability. Limits of stability is the maximum displacement that you can get, okay, without taking a step. So I'm doing this, I'm doing anterior and posterior, which is about 12 degrees. And doing side to side, which is about 16 degrees, okay? And this is required in our daily life, right? You need to reach forward to something, okay? And without taking a step. So this kind of limits of stability is really giving us that cone, okay? You have a fulcrum there, but on that I can move forward, backward, okay? 12 degrees, side to side, about 16 degrees, okay? It's always a problem for our patient to do this movement, okay? Even with old people without neurological impairment, the posterior displacement is always hard. If you practice or you have any balance system, okay, when they test the limits of stability, you would see that from the center to the posterior, it's a very short amount, okay? So it's really shorter than forward displacement. I can go there. So I have my extensors, they are good, okay? Calves are good, so I could lean forward very good without taking any step. When it comes to here, my first line there, the anterior tip muscles, they are not that strong. Usually, we train them at the gym, the calf muscles. It's very easy to do heel raises, right? But when you are trying to treat patients, when you give them instructions to do toe raises, it's really hard for them. So toe raises is kind of, and I don't think there is a machine at the gym that trains the dorsiflexor. Have you ever, people who go to the gym, seen one?
So I put like a little, you call it the row thing, and I do this.
Okay, so it's not a machine like
No.
the one that you stand and you have the weights on your shoulders and you do the heel raises, right? It's not, this is for the calf muscles, right? Okay, and glutes have, quads have, leg press for the quads and glutes, okay? But there is no specific one for the dorsiflexors, right? So go to the gym, when you go next time, try to find one, okay? Let us know about it. Okay, we also need aesthetic postural control. That's needed to maintain the static posture. But the dynamic one, I need the dynamic postural control to reach forward to things, right? I need it to kind of like move in, but still within the base of support. Dynamic balance is which required during walking. When you walk, when you run, you need the dynamic balance, right? Anticipatory postural control that is required when I try or to make some adjustments for common thing. Like if somebody throwing a ball towards me, I'm gonna hold it, right? So I started activating and moved my upper extremities, right? But at the same time, because my line of gravity moved forward, okay? Because my arms moved, I activated a little bit of back extensors. Okay? So moving the arms requires adjustments. So the body anticipates that the arms are going to move forward, so activate the back extensor. Reactive balance, we know this is for perturbations. You remember, neuromuscular one, we tested both. We tested the anticipatory balance when we have the patient leaning forward, right? We tested the reactive balance when we gave the patient perturbations and nudges. Postural fixation reactions, that's when you try to get your body kind of stable, okay, in response to an external force. Okay? You try to protect yourself from falling. Tilting reaction when you are on the tilting board. Right? Rocking board, that's when you need the tilting reaction. Adaptive balance, that's when a change in the environment would happen and you need to adapt to the new change to maintain your balance. The definition of these is at the beginning of chapter 9. This is the second edition, not the third. Okay, so here are the definitions. All of them are here with example. Okay, so you may see questions today in our quiz, or you see in the first exam. So, know where they are now? The definitions of these, all of them?
Chapter 9.
Chapter 9, okay, first page of the chapter.